When deciding to choose this topic, I thought to myself that mental health in athletes is overdone. But then I realized that's the whole point. Mental health support for athletes is a topic that feels tired and repeated. But clearly, nothing's really changed or gotten better. After hearing Caitlin Bracken, a player of the Vanderbilt women's lacrosse team, speak out about her experience and struggles through her transition from high school to collegiate athletics and academics, it convinced me that this topic is still needed to be discussed. Tonight's theme is change. When I first found this out, I thought of more so the lack of change in support for athletes. But then, after thinking about it, I found the root of the problem. Hi, my name is Grace Smith, and I am here to talk about mental health and the change from high school to college athletics. Young athletes' aspirations soon become expectations as they approach high school. For example, the expectation to commit to a college by their senior year. Not only do these teenagers have to balance athletics and academics, but also it is an expectation to participate in a club, team, and extracurriculars. These activities don't even include multi-sport athletes who rarely have an off-season. Expectations for teenagers are already extremely demanding. To balance and succeed in academics and extracurriculars while being social and overall being happy is almost impossible to meet. And to add on athletic pressures, it is not surprising that it would toll on these athletes. A simple definition of depression is a disorder that affects one's mood and causes persistent feelings of sadness and loss of interest. Clinical depression affects how one feels, thinks, and behaves, controlling and taking over their mind, and is commonly caused by a chemical imbalance in the brain and or external pressures. One who likely suffers from disorders like depression and anxiety has gone through this their whole lives, but then it is typically amplified through the pressures faced in high school and college. For example, Madison Holleran, a seemingly perfect track and field athlete at the University of Pennsylvania, struggled throughout her whole childhood. Madison fought to exceed expectations and holding herself to impossibly high standards in all aspects of her life. She even switched from both schools and sports just to attend an Ivy League. Despite the self-doubt Madison faced when she was younger, all of these struggles were emphasized in her transition from high school to college. Unfortunately, this Ivy League athlete who seemed to have it all took her own life January of her first year of college. The change from high school to college is a common struggle for anyone, and overall, college is difficult, but to add a demanding sport, it is not surprising that the pressure affects these athletes. A common high school schedule in season is 8 a.m. to 3 p.m. school, 3 p.m. to 6 p.m. practice, or even 7 o'clock for a game, and then 6:30 to 7 o'clock dinner or team dinner, and then not be getting their homework until around 8 o'clock. The earliest a high school athlete starts their homework is probably around 7:30, only likely if their dinner is right after they get home. A typical amount of homework for a high school student is about half an hour to an hour per subject. Schools with block schedules, similar to Oak Knoll, that means 4 hours of homework per day. For athletes in season, most likely this means finishing their homework around midnight. If not, busy cramming for their test the next day, or even starting a brand new paper that's due first period. Of course, this is all unless they give up their homework to go to bed earlier and save it to do during a study hall, flex time, or even lunch. This schedule is evidently packed. Then clearly there's not really time for extracurriculars or socialization. To have making new friends without their parents in their living space, the adjustment to college makes it highly unlikely to be unfazed by this transition. An example of a Division I athlete's schedule is cramming 3 classes and squeezing meals in between each class, an hour and 15 minutes for a warm-up and prep before practice, 3 hours of practice and lift, and then not starting their homework and leaving the facilities until 7, and then not finishing until around 11:30. A Division III athlete's typical schedule is 2.5 hours of practice 6 times a week, 2 to 4 games per week, and 4 to 6 hours on the road. And when on the road for away games, they typically spend 2 days away, which means missing classes. I asked 2 college athletes a series of questions. These questions include, how has your adjustment been? Well, athlete 1 says it has definitely been a challenge being away from family and friends and their main support system. And they realize that they really need to balance and find their own alone time for self-care, especially in their packed schedule. Athlete 2 says it wasn't extremely difficult, but because of the coping habits and study habits learned throughout high school, and which has helped them with the new challenges they face in college. Question 2. Has your transition taken a toll on you mentally? Both of them said definitely yes. Athlete 1 had faced many challenges and experienced a lot of stress and high pressure in their sport and trying to adjust to a new team and holding extremely high expectations for themselves, trying to find a role where they could contribute the most. Athlete 2 also said yes, but clearly not as much as others that they had witnessed because of their experience in high school. Question 3. Has your support that you were provided with in high school helped you? Both of them said yes, and it made their support that they received in high school made it as easy as possible for them to transition. Athlete 2 said that they can see how others did not have the same experience as them, and that it definitely affected them in their transition, taking a toll on them mentally. Meanwhile, athlete 2 had faced anxiety and stress and learned how to combat those problems, and then going on to college, used those same resources to help combat the problems that they faced during their transition. Question 4, does your program provide resources for you mentally? Again, both athletes said yes. They are provided with professionals like psychologists and mental health specialists, and both of their programs have coaches that are open and available to talk to about any problems, especially mentally. Now, question 5, would you feel comfortable taking a break from your school or program? And both athletes said that they would feel comfortable, that they would feel loved and supported if they needed the help. But they both would feel uncomfortable bringing it up or even taking a break in general. Athlete 1 said that they wouldn't even consider it an option because of the pressures they face and that the nerves of someone else taking their spot and that they couldn't contribute to their team. Athlete 1 also believes that even though there is more light around mental health for athletes, there's still definitely a stigma that if you're not physically in pain, you are fine, and that mental health problems are seen as weak. Athlete 2 even said that even though they would feel loved and supported by their family and teammates, that they would feel like they'd be letting them down. They feel as though their family sacrificed so much for them to be there that it would be selfish for them to take a break. And that because their team is relatively small, it would be affecting them in practice and their execution in games. So, through these responses, it is clear that there are both positives and negatives. There are changes in resources that are clearly a benefit, like this psychologists and professionals now being hired on to these programs. But there's definitely still a stigma of being classified as weak, or as if you're gonna let people down if you need to take care of yourself. It is also clear that the high school experiences of these athletes impact heavily how their transition goes. Luckily, these athletes did have a good transition, but as athlete 2 said, that it is clear that other athletes did not have the same experience as them, and that it definitely affects their mental health when transitioning to high-level college athletics. As I said before, my goal for this talk was to express the root of the problem. But the root of the problem is that this is the sport in high school athletics and how that will help combat the struggles faced in college. It is highlighted through the problems faced in high school are highlighted through the transition, and that amplifies their struggles. Like Madison Holleran, who sadly took her own life after struggling with mental health from even a young age, when no one else noticed and could help her, it was then amplified when she attended college and didn't know what else to do. I believe that the number one way to resolve and combat mental health problems for all college athletes is to start by addressing them in high school. Thank you.